And from that story on El Nino, we move to a focus on cancer. We're happy to have in studio with us Dr. Nelly Bosire, who's an obstetrician and a gynecologist. She joins us again to share her wisdom and insights. Just to give you some statistics, some basic information, globally cancer causes more deaths than HIV, TB and malaria combined, if you would believe that. And 70% of that burden is borne by low and middle income countries. That includes countries like Kenya. 30% of cancers are curable. Having said that, we clearly are taking on a very heavy burden. We can see our health system is having a challenge dealing with it and trying to increase the capacity. But let's start with early detection, Nelly. Yes. How do we ensure that people can detect cancer early, because we're told the best chance of cure is in early detection?
Well, see, the unfortunate thing with most cancers is that by the time they're showing overt symptoms, then we're already talking at least stage 2 going forward, because patients are looking out for masses, and a lot of them, they may actually see these masses, and if they see them before they actually think to have them checked out, then they've wasted a lot of precious time. Most people are waiting for discomfort signs. I mean, it's not uncommon to see a Kenyan walking around with something big swollen out of their jaw, and they're not bothered by it. But when it gets painful, then now they come to the doctor. So early detection, any abnormal growth in your body, you're safer getting tested rather than not, because it may or may not be cancerous, but there are very few cancers that we can actually effectively screen for. And those we have talked about them. But majority of cancers, they don't have straightforward symptoms. They don't have a screening method, and they're things that we'll stumble upon after having treated them as different things for a very long time.
So even our medical fraternity, is there a need to up the game?
Absolutely.
Right.
As we speak today, the doctors fraternity just lost one of us yesterday. She also succumbed to cancer, and she's fought this very bravely for the last few months. She's been to India and back, and you can imagine she's a medic. She deals with this every day. She knows what's coming, staring at her in the face, and rest in peace, but you know, we still ended up losing her today. So that tells you just how bad this crisis is, that even those who know what to expect will not see it coming until the bus hits you right in the face.
That's really frightening. It's really shocking. Before we go to my next question, which is going to be related to the fact that even our own medics have to travel to India for treatment, before I come to that, let's ask the question, let's pose the question. For many people watching, sometimes you're so busy with life. Sometimes the cost of going to a hospital, to pay a doctor, to pay for medicine, you worry about those kinds of things. So you'll ignore something. If it's possible to give advice today, what would you tell our audiences to be wary of at home?
Never take your health for granted. If you have a sensation that something's not right, more often than not, you are right, that something's not right, and have it checked out. The second thing is never be too busy for yourself. I mean, we also need to look at even the way our health is packaged, that even our insurances are very antsy about supporting screenings and regular checks, and you know, it should be mandatory. Now we have NHIF coming on board. Everybody who is entitled to NHIF should actually be entitled to at least an annual checkup, you know, because it's in those you know, things that you know, a lot of patients who are actually found to have cancer may have come to the hospital for totally unrelated conditions, and they'll not remember to complain about what they've lived with it for so long, because the symptoms are they come, you know, slowly over time, so they don't take them very seriously, or they don't, no, they learn to live with them rather than have them checked out, and by the time they get to the point of having checked out, it's too late.
A powerful message to insurance companies, to NHIF. Kenyans should be entitled to a mandatory annual check to make sure that we are screening for these things that are killing us. And right now it's the third largest killer in terms of conditions in Kenya.
Absolutely.
Let's go now to the fact that so many people have to go to India for treatment. And my question is, when it comes to government, we know that they're trying to scale up. It may take time, there will be challenges, but we have a vibrant private sector in this country. We have a vibrant insurance, health insurance sector in this country. Shouldn't we raise the challenge that even partnerships could be established to ensure people can get the treatment here on the ground? Why not partner with Indian hospitals and doctors to do that?
you know, truthfully, a lot of the skill people go to look for in India is not necessarily out of reach in Kenya. The most disheartening thing is that most doctors will go out there, acquire these skills, and come back home, and you don't have the facilities. And once, you know, medicine is an art. If you don't practice it, you will absolutely lose the skill, and it will not be useful. So sometimes I may not necessarily blame Kenyans for living, because you're looking at a doctor who will tell you, I can treat you, but the last time I did this type of surgery was a year ago, and here is somebody who's doing these things on a weekly basis. Who do you feel safer with? So what, I mean, for us, the message out there is that we've done a lot on screening and health education. We need to translate equal effort to treatment. The curative sector in cancer in Kenya is seriously lagging behind. We've had private sector hospitals put up these very nice oncology centers, but first of all, there is lack of coordination. What a lot of people get when they go out there is team effort. That you have all these doctors under one roof. That when you go to the hospital because you're going for cancer care, the person taking care of your chemotherapy is in the same room with the radiotherapist, is in the same room with the person handling diagnostics, and so you don't have to keep moving from one person to the other to have your care fully taken.
Where does the greatest responsibility lie to deliver that to Kenyans?
Ultimately, we start from who's the provider of health. You see, whether we can talk about the private sector, but it only caters for 10% of Kenyans. Only 10%. 90% are
rely on the ministry and on the county government.
And we cannot ignore that. Our policies are not strong enough to support curative care in cancer. Not yet. And we cannot have one public hospital with radiotherapy machine. Let's just start there. That's just a sign of what else we don't have.
Powerful, powerful. Thank you. Dr. Nelly Bosire speaking there on the situation in Kenya. Now, we're going to go to a story on cancer before we talk about what's coming up this week, something you can participate in on Saturday. Now, a village in Meru is reeling from a highly unusual number of cancer cases. Although health authorities suspect the cases are caused by a substance in the diet or water, no comprehensive study has been conducted yet to establish the actual cause. Esther Kahumbi looked into this for us.
An anxious Anne Gitonga desperately calls out to her mom. Her mother's condition has been worsening by the day. Diagnosed with uterine cancer a year ago, her chemotherapy treatment had to be cut short after she developed kidney problems. Unable to afford hospital fees, they were forced to bring her back home. They have had many such mornings when they wake up and she's unresponsive, and then the rush to get her to a doctor begins.
Hali yake inakaa tu ikibadilika, wakati mwingine anakula, wakati mwingine anakula, wakati mwingine anaongea, wakati mwingine hawezi ongea.
The nearest hospital that can attend to her is kilometers away from their Kegoi village of Meru County. It is not a story new to this village. They have all been affected in one way or the other, participating in fundraising initiatives for the many who are undergoing cancer treatment or attending burials whose frequency has increased.
Kama juzi nimesika watu kama 11 kwa location mzima. Na hiyo yote ukisikia ni kansa. Sasa tunashangaa ni nini kansa inakuwa tumazi hapa.
One of the many funerals that the local chief has attended was that of his assistant chief's father. He died of prostate cancer.
2014 December nilikuwa nampeleka tu kwa matibabu. Nililikana kuna hiyo ugonjwa prostate cancer. Akaugua kutoka wakati huo mpaka Machi wakati nilipeleka hospitali akaaga tarehe 4 mwezi wa 3.
Although Meru is 4th on the list of counties with the highest number of reported cancer cases, the fatalities have the county gravely concerned. From this vantage point, locals tell me it is easy to point out the homesteads that have lost someone to the disease. In one of the houses lives 55-year-old Francis Kanyinga, who was diagnosed with stomach cancer. Months of chemotherapy at Kenyatta National Hospital did little to stop his suffering. He now lives on morphine to reduce his pain, administered to him by nurses from the Meru hospice who have him on their home visit list.
na inanihangaisha sana. Hospitali zote ninasaenda hospitali yote, nikafanyiwa operation, nikaambiwa niende Kenyatta. Nikaenda Kenyatta, kaishi hapo kama mwaka moja na miezi 4.
Hundreds of residents of Meru County have been diagnosed with cancer, and the list is growing. The treatment and management of this disease has shot to the priority list of the county government. What ails Meru County?
The food people take, and whether people are fumigating crops using chemicals without any protection, and may actually increase their own risk of getting a cancer.
The county government says 15% of patients receiving cancer treatment at Kenyatta National Hospital are from Meru. That's slightly over 1,500 new cases were recorded in 2014. Statistics which have the entire county looking for answers to this one question: what could be the cause?
You can associate it with the chewing mirror, and maybe this mirror maybe has been sprayed, and maybe they didn't wait for the chemical. You see, the wrong thing, people, they spray and they don't wait the duration that's given.
Stomach cancer is the most prevalent in Meru, followed by oral cancers, suggesting the cause could be in the foods eaten here or the water.
We started noticing the highest number in 2011. Our concern was in a particular village in Meru North, where we had so many patients who came with oral cancers. The cancer of the mouth, the tongue, the mandible. And we actually wanted to know what is happening.
The situation in Meru County is symbolic of Kenya's worsening cancer problem. Statistics show Nairobi County is leading in cancer prevalence with 3,930 new cases in 2014. Nyeri is second with 3,895 cases. At number 3 is Uasin Gishu, which reported 1,962 cases. Cancer is now the third leading cause of death in Kenya. It kills about 18,000 people annually.
By end of this year, the deaths from cancer are going to surpass that of HIV, TB, and malaria combined. So it means that we are actually almost facing a disaster. As multiple, yes.
Despite the disturbing numbers, the country is yet to conduct comprehensive research on the cause. What would be an important step towards prevention? The Kenya Medical Research Institute is yet to collect samples in Meru. Officials say they have first to map the entire country before research can commence.
Before we can even go in and start ask the question why is this cancer high here, we first need to know which of these cancers, where is the burden. Is it really stomach cancer that is high, or is it that this was just seen in one area?
But the country will have to wait another 2 years before mapping is complete. In the meantime, lack of enough doctors to treat the disease is a big concern.
Currently, the doctors who are specialized in terms of oncologists, they are less than 20. So that means that even to manage these 80,000 new cases annually, 20 people will not be able to do it. You need to train more people so that at least you have a good number.
In Meru, the county government is setting up a cancer center and has contracted an oncologist from Kenyatta to attend to patients in the county. A small step, which if replicated elsewhere, can help ease the burden.
We are also hoping to, in the coming 3 years, develop our own linear accelerator here, so to be able to give radiation to those who require radiation.
Still, the question remains, is the country doing enough to confront this rising problem? Esther Kahumbi, Sunday Live.
Well, 2 years seems like a long time to do that mapping or to start that mapping. It's critical information. You can't plan and you can't address the problem if you don't understand the need.
That's right. I mean, right there from that story, the most immediate thing that sticks out is we are not investing enough in research. And cancer research is not something that you say, I'm investing this year, next year, I'll think about it. It has to be continuous research that is seriously geared to giving us answers. And then on top of that, we're not as you can see, I mean, what they're not telling you is, first of all, Meru as a hospital, its catchment population is the entire Upper Eastern. Everybody from Isiolo, from Garissa, from Moyale, they're all coming to Meru. The hospital is overwhelmed as it is before you start adding its own problems within its own county. And what they're saying is important. Every level 5 hospital in Kenya right now should be having a standalone oncology center. That alone may go a long way in eliminating a lot of the problems and early treatment. A patient seen in Meru requiring radiotherapy in Kenyatta is not going to take less than 18 months before they're taken care of. So what was stage 1 disease, by the time they're starting treatment, is stage 4.
It's a death sentence.
Absolutely.
Dr. Nelly Bosire, speaking on the needs in Kenya right now for cancer care, cancer treatment. Let's go to the event on Saturday, Nelly.
Well, we're doing in our own small way something to try and change this, and we're looking at the Relay for Life, which is coming up on Saturday. It's a 24-hour event that's going to be held at the Nyayo National Stadium, a fundraising event that aims to raise money basically to address health education, patient support, most importantly patient support, and this is hosted by the Kenya Cancer Association. And on top of just hosting the Relay for Life, the most important thing Kenya Cancer Association has also been doing is trying to advocate for policy change, not just to take care of the here and now, but going forward, making sure that our governments and all our stakeholders are on board to make it a lot easier for the cancer burden. So the event is happening at Nyayo National Stadium. It's a family event. Everybody is welcome. We're going to be around the Nyayo National Stadium racetrack for 24 hours. Registration is ongoing in town. Our registration partners at T-Mall, we have the Point in Buruburu, we have Garden City Mall on Thika Road, we have the Omega Optician branches in town at IMAX, at Jivanji Gardens, and at Hurlingham Plaza. 1,200 shillings. We're asking everybody to come join us. There's nobody who can say they've not been touched by cancer in this country.
Thank you so much for joining us, Dr. Nelly Bosire. And do get registered if you want to take part, and you've heard it's happening at the Nyayo National Stadium. Well, we're moving on now to take a look at